Hello, let's continue our discussion on stomach pathology by continuing on gastritis and particularly chronic gastritis. We have already talked about gastropathy and we talked about acute inflammation in acute gastritis, and now it's time to talk about chronic gastritis. Now, chronic gastritis is more persistent than acute gastritis, and the symptoms are ranging from mild to moderate, but it took more time and it's persistent for a longer time than acute gastritis. And we talked about how gastropathy is is pretty much hyperplasia of the foveolar cells of the stomach, of the intestine, and we have edema and congestion, but no inflammation. That's why we cannot call it gastritis. We call it the investigators called it gastropathy. However, if you have gastropathy symptoms and in addition to them you have leukocytes and lymphocytes and plasma cells indicating inflammatory infiltrate, that means you have acute gastritis. If it is persistent for a very long time, and depending on the pathogenesis and the diagnosis, we can tell that you will have chronic gastritis. So chronic gastritis is majorly has two causes. 90% of the cause is the gram-negative bacillus rod-shaped bacteria known as Helicobacter pylori, H. pylori, while 10% of the case is called autoimmune gastritis. So when it comes to H. pylori and autoimmune gastritis, we're talking about chronic gastritis. H. pylori does not cause acute gastritis. It's asymptomatic for the whole time. When it becomes, the symptoms become very severe and it's more persistent, then it appears at the level of chronic gastritis, no acute gastritis. Okay, another thing that you should be very aware of, and that is Helicobacter pylori is a normal inhabitant of our stomach. In fact, there's some research that shows that it's very important in regulating appetite, very important in regulating the acidity of our stomach, and very important also for monitoring who colonizes our GIT. They spare some bacteria and they fight on our behalf other invading bacteria. So it resides in our stomach and it's swimming in that acid pool that is contained within our stomach. However, itself, the H. pylori bacteria does not enjoy that acidity. In fact, it is suffering from it. However, the H. pylori enjoys some superpowers that allows it to survive in that pool of acid. And in fact, these superpowers may sometimes become very powerful that enable the H. pylori to attack our own stomach. So first, let's talk about these superpowers that the H. pylori has that enables it to survive the very extreme acidity of our stomach that no bacteria can survive. First of all, it has an enzyme called urease. Urease is an enzyme that has the ability to catalyze the reaction that converts urea into ammonia and carbon dioxide. And why is ammonia important? Ammonia is very important because it brings down the acidity within the vicinity in which the E. coli is swimming. So that's the first superpower. H. pylori has. It has the enzyme urease that make the very acidic environment less acidic. And we know that in our stomach, we have cells that secrete bicarbonate, and bicarbonate also brings down the acidity and helps our own stomach survive that very hydrolytic acid that it contains. It also has flagella. Flagella is what enables there are these components that enable the H. pylori bacteria to bore into the epithelium of our stomach and start digging deep in there. Another superpower it has is the chemotaxis. Chemotaxis is the gravitation, is when the bacteria starts walking and gravitating towards, when the H. pylori bacteria starts moving away from the acid environment and gravitating towards the sides into our epithelium, into our stomach. Remember, we talked about how the mucus layer is basic compared to the acidic environment, and we have many active processes that ensure that this mucus layer is secreted, and there's bicarbonate to ensure that it remains basic and it doesn't disintegrate in that acidic environment, and there's blood flow to nurture all these foveolar cells that keep on secreting the mucus. And we also have, this blood coming in, providing these cells with oxygen and nutrients, and washing away and removing any toxic metabolites that build up in the cellular reactions. However, the H. pylori starts to become attracted to that environment, that epithelial environment, and it starts swimming and gravitating towards our stomach, from the core, from that acid core into our stomach. It starts digging and boring with its head, with the flagella, to enter into our mucus layer and the mucosa, and to dig into the epithelium. Then there are more superpowers like adhesins. Adhesins are components that enable the bacteria to adhere to the lipids, and also adhere to the proteins and fatty acids that are on the surface of our epithelial tissues. And then the H. pylori will colonize in that basic environment and start to cause for us inflammation. Begins with acute inflammation, but the symptoms manifest later on as chronic gastritis. And the H. pylori bacteria also causes for us ulcers, and it also has another superpower, and that is it has toxins. These toxins, the bacteria is able to secrete them because it possesses a gene called the CAG, cytotoxic associated gene A factor. This CAGA, cytotoxic associated gene A. This cytotoxic associated gene A enables the bacteria to transcribe toxins that enables it to destroy the epithelium of our stomach, and it can even cause cancer. That toxin, and this is how H. pylori is implicated in the causation of neoplasia. So H. pylori gastritis is a chronic gastritis, and it's not a neoplastic one. It is an inflammatory lesion, but later on it could develop into a neoplastic lesion. So this is pretty much what we should know. Also, we can also deduce how they diagnose the H. pylori infection, and it's by urea breath test, by detecting urea in the breathing of the patient, and that will show you there is activity of that urease enzyme possessed by the Helicobacter bacteria. Also, there are antibody tests called anti-Helicobacter antibodies. We could also test. We could also do culture bacteria for a specimen. We could take a specimen from the stomach and look for the Helicobacter bacteria. We can also do a stool analysis, stool culture, and this is the major thing that we must be aware of, and that is this bacteria H. pylori is very involved in the causing. It's pretty much 90% the cause for chronic gastritis, and also NSAIDs play a role, and chemotherapy also plays a role in damaging, because always remember that the main issue when it comes to gastritis, it's that thick mucus layer becoming impaired. It's not synthesized properly, it's not maintained. The acidity is been overwhelming, causing the deterioration of that mucus cell. So I leave you with this, and we will talk some more about autoimmune gastritis. Okay. Thank you very much.